Worried that dental bills in your country might put you in debt? You're not alone. But hiding your smile for months or years shouldn't be the only option. That is why thousands are turning to Mexico for affordable and high-quality dental care. Still, we get it. Safety and trust matter. You don't want to deal with scams, unequipped clinics, or language barriers. You want someone to guide you, to be by your side every step of the way, so you don't waste your time, money, and mental energy. That's where MTC comes in. Curious to know how we help? Keep watching. Point number 7 is the one that makes most patients finally say, okay, I can do this.
At least a 50%. For example, I have known patients that they pay $1,000, $1,500, or $2,000 for a wisdom tooth surgery. That here at the most it can cost $250. So you compare that, and for example, a lot of patients are required by their dentist to do a deep cleaning. And what is called a deep cleaning on the States is here a regular cleaning. Is the removal of all the tartar and the polishment. So after they get charged $200 or $100. So what is cost here $49. So in crowns, in implants, even on the All-on 4, All-on 6, the All-on 6 has a cost of $9,000. And on the States, at least should be $20,000. You don't need to damage your finances in order to get a worldwide quality dental service. Medical and dental procedures down in Tijuana are more affordable because of the cost of the country. For example, in California, they have tax over tax over tax over tax. So even the dentists wanted to do it more affordable, they cannot.
In our office, what we're mostly famous for is the All-on 4s. That's what everybody comes in. We have patients who come with estimates of 30, 40,000. They come here to my office between 12 to 18. We will do all the work. Everything is included in the price. Once we give you that estimate, that's the final price. It will not change. If it does change, we will let you know before we even do anything. We will let you know what, your estimate is going to go up a little higher. We have to do this and this. Or you know what, we didn't do this kind of work, so your estimate will go down. So we try to just do the estimate the right way the first time. That's why usually we have to do the CAT scan first, and then we will go ahead and do the procedure. Make sure we give them all the information that they need and they agree, then we can go ahead and continue. We accept cash, check, Zelle, PayPal, or credit card.
Human labor is always going to be more affordable here in Mexico than the States. And secondly, by having lower cost of rent and things like that, it also allows us to have lower costs in regards to the procedures that we offer. Now, it doesn't go along with lower quality. We maintain the same quality standards in the States or even higher in some places. But at the end, the reason why is we're using the same materials, but everything's more forward here in regards to rent, all that. So that gives us the benefit of being able to provide patients with a lower cost of treatment, maintain the same quality. Also because we don't focus on the revenue, we focus on the patient.
No hidden cost. You are very transparent. We have different package. We have basic package, we call it live, that it only focuses carrying only on the procedures. Let's talk about basics, only the full open ears. Then we have other type of packages, such as the smart package that includes pop and transportation.
My name is Dr. Rivas. I am responsible in the diagnosis area and I am a clinical director. I have been working for the last 30 years. I am a dentist from the University of the Guadalajara, and I have 2 different specializations. One of them was to the root canal specialist, and the second one is in the implants and rehabilitation. Our specialist finded here is a root canal specialist and oral surgeon specialist, implantologist specialist, periodontal specialist, rehabilitation specialist. Practically with all the specialists sometimes working is together with obtain the best results when everyone passions, right?
I'm Dr. Alejandra Aguilera. I have 15 years as a dentist and still counting. I'm the dental director.
I'm Dr. Vieira. I have more than 10-year experience. I've been working around the world. I'm working Spain, Morocco, Germany, Netherlands, and other countries in Brazil. Now I'm working in Mexico. I'm a specialist in dental implants and makeover and aesthetic dentistry, and I'm a dental technician as well.
I am Dr. Berenice Acosta as general dentist. I have 17 years of experience.
This is Dr. Leon. I am an implantologist and neurosurgeon around 15 years. Our office has 20 years working with patients all across the United States and Canada. Another diploma I have. This is from New York University College of Dentistry. So basically this is that current concepts in American dentistry like implantology and auto rehabilitation. Because for me it is really important to competitive or this part to be competitive like the American dentist.
I think that the team that we have here, it's a very united team. The communication is very close, right? So whenever some things are needing, let's say, opinions on different specialties, it's easy for us to ask on specialists on their opinions and go forward with a more sure treatment plan.
Coming to the doctor, it's far easier than before because a lot of patients get very traumatized between go to the doctor because it's gonna hurt, they're gonna hurt a lot, and they get so afraid of going to the doctor. Now you have the advanced technology about the anesthesia, about the scanner, about everything to make far easier. And the patient maybe, okay, that's it, it's finished because it was so fast, it's no hurts anymore.
We do have the help of the CT scans, right? We also do digital scanning, and that does improve timing for further appointments, right?
The best part now is we have the lab in-house. That is part of the big reason for try to give you a complete service because, you know, when I find that complexity in the cases, it's possible to do everything in 4 or 5 days.
We work with, with the scans, we work with panoramic x-rays, we work with machines for make crowns. It's not necessary take impressions. We can scan them out, we can send the file to the lab, and after a few hours we have the crowns.
Whole area is divided on different specific parts of the process. So here we have pretty much the final part. We have when we put on our porcelain, when we do all the makeup on the aesthetic part of the prosthetic piece. We have a closed area that is the ovens. So here we have the ovens or the porcelain, we have the ovens for zirconia. So this is pretty much just the area for finishing that part. So here with our have-done equipment, our technicians do the designing. It's actually one of our designers. And so as you can see, he's actually designing right now. He does the design, he does the prosthetic part in the computer. So we can receive here the information in 2 different ways. One way is that if the patient for some reason cannot have an intraoral scanner, we do the regular impression and they scan it right here. Most of our patients right now receive an intraoral scanner and they receive the scan right away. As you can see, this one is actually working right now. We can do like the full zirconium crowns, we can do full zirconium plates. Yeah, these are different kinds of ovens that we have. For example, these ovens are for zirconium. All of these are for zirconium. We do here the sinterization process that we have at the end of the crowns or at the end of the plates. This is a printing area. We have different kinds of printers. We have different materials to print with. And what we do is that we have selected equipment specifically for different kinds of material. So let's say that we want to print something like this. This is a model. This is so like to fit on a patient, and it's like a full implant supporter, as you can see. So this is like a test model for the patient. And this one it's printed in one of these These are for models. This one we use for printing the surgical guides for implants. And this one we use to print the plates, actual final plates for patients. Instead of using acrylic right now, like the regular acrylic, you use resin and you print them right here.
This is microscope. Usually we work with this microscope when we do root canals. Every single root canal is being made with a microscope because obviously will give us a better range successful for every single root canal. Some additional thing I need to let you know, we do the root canal same day as we place the crown. So you can come to us, to our dental office, you will have a root canal made with our microscope, and you can have the crown placed same day with our CAD/CAM technology, which is a crown performed or made same day.
About the process of the sterilization, that is, we have the most highest quality in the world, right? This is not compared with only local government's rules. It's compared with around the world. That technology, again, I insist a lot in talking about with the technology, but at the end, we have strictly protocols. It's common to see in everyone dental chair, you can see 30 more minutes to cleaning, a deep cleaning in everyone dental chair. That is our protocol day for day, patient another patient. About the instruments, we have two different protocols. One of them is clean with the ultrasonic system and sterilizer with the electronic equipment. And between and both of them, we have an testings for confirm if that both of them process is well. Well, finally, about to the sterilization in the inside to the cleaning is we have a strictly schedules about to the every 15 days. That is go for that deep cleaning inside to the all the clean.
We are located in Tijuana, Mexico. We're just 5 minutes away from the border. And our location is on the business district. It's a very safe area where you can walk around. There's a Starbucks across the street. You will see Domino's. So it's a very safe area to be. Our sterilization protocols are the same that you manage on the US.
I think probably Los Cabos has to be probably one of the safest places in all of Mexico, right? There's a big community here of expats from the United States and from Canada. And really, just the atmosphere, the people, they're very friendly, very warming. And as it's a tourist economy, everybody treats the patients with a lot of respect, right? So the crime is almost unheard of here and is very safe.
So this is our sterilization room. We start off cleaning the instruments with some special dish. And then after the cleaning is done, we can put it in the digital ultrasonic cleaner, which is this one. This one has a special liquid that sterilizes and does this little vibration, which cleans the instruments and everything that we use. And after that is done, then we can use the digital sterilization machine.
Okay.
And it goes in a cycle for around 40 minutes, 30 minutes, and then the sterilization cycle is complete.
There is a lot of news on TV or internet. There is a lot of information about Tijuana. But you know what? Sometimes social media, it shows more big problem that really it is. So what I can tell is just give us a call. We can take care of you. For example, our driver can pick you up at the airport, take you and bring you safe to our office, and we can recommend you to visit a really safe hotel in a really good safe area.
What is the reason for choice? Is because, well, the location, that is a fancy location, you can find it a lot of activities around to that clinic.
Depending on what the patient's like, there's little street tacos, but there's also really nice restaurants here in town. There's called Pueblo Viejo, Mi Casa Su Casa. There's different little restaurants that patients can go and enjoy and live music and have drinks.
You have a lot of cafes, restaurants, and Plaza Rio is the most popular plaza around here. It's very close to the Serna Hotel. You can even get walking there like in 10 minutes or less. And you're gonna have a lot of fun stuff. Even if you decide to go to downtown, which is actually pretty close too, you're gonna see and experience a lot of fun stuff. If you come to Tijuana and you do not get a picture with the Sunky, which is like a zebra and donkey combination that we have in here, you didn't come to Tijuana. Here, there's Starbucks, Domino's, the Costco. Everything is gonna be pretty close from here. The downtown, there's Avenida Revolucion, which has a lot of souvenirs from Tijuana. I feel like you can even get stuff from the 80s to the 2000s, and it's pretty fun. Actually, we do have a Mercado Hidalgo close to the Plaza Rio, and you're gonna get a lot of Mexican items, candies, piñatas, pins, everything there.
Los Cabos is Cabo San Lucas and San Jose del Cabo. So in San Jose del Cabo, it's more traditional. It's a little older. It's a city that's a little older. So there's lots of things you can do here besides going to the beach. It's a big surfing community down here as well. So that's very big. Also downtown San Jose is very beautiful. Lots of old buildings and fun things people can do. So yeah, that's definitely some extra activities patients can get into. If patients are more interested in maybe the nightlife, there's great nightlife in San Lucas. There's lots of different bars, restaurants, nightclubs, and also they have a very famous beach, which is Medano Beach. Lots of people are attracted to that beach because one of the main attractions of Los Cabos is El Arco, and that's where it's located in Medano Beach.
We're usually located in Los Algodones, Mexico, which is south of the border from Yuma, Arizona. Usually we give them a call and we let them know, like give them instructions how to get to the office. Our office is like 3 blocks away from the border, so it's really easy to find us. If they decide to walk, there's a big parking lot on the US side. You just park your car there. You can even leave it overnight for patients who don't like to cross the car, that don't have insurance and all those little things. They offer all those stuff. We offer a service here that we can have a shuttle. We will pick up our patients at the border, bring them to the office. Pretty much once they're here, we'll help them out with everything as far as scheduling a hotel, medication, and all the little things that come with the whole service. We have a hotel that we work with. They give us a really good rate, and we pretty much help them get their hotel once they book the appointment here with us. So once you get to the office, your hotel is already all set. The hotel in Los Algodones is called Hotel California. For your standard room is between $40 to $50 a night. If you want something a little bit bigger, like a little suite, is between $80 to $120 a night. Everything down here is just like if you were in the US side. I mean, everything is really clean. Everything, they keep the whole area, maintain the whole area safe for all the patients. There's cases where I even take the patient out to eat and we go ahead, enjoy lunch, come back to the office, and I'm the one who will pretty much help you with all those little things.
So this is the International Airport of Cabo San Lucas. You can find it at SJD, right? And there's direct flights from lots of places from the United States and Canada. We're very close to the airport, maybe about 15-20 minutes away from the airport. And there's actually lots of easy ways to get around, right? If the patients that rent a car, I think it's the best option for them. Not only to come and go, but also they can go visit places that are nearby, right? Some patients stay in San Luca, some patients stay in San Jose. Difference maybe about 20 minutes between each city. So if patients want to get out and maybe go explore a little bit, renting a car is definitely the way to go. And the Ubers are also very accessible, very easy. You can order an Uber, it might get there in a couple of minutes. So the transportation is very, very easy here in Los Cabos.
And when you go back home, sometimes we have questions, doubts. There's a 24/7 line that is always answered. After business hours, it's my responsibility to have that contact with the patient. Sometimes they forget because it's a lot of information. About a medication, feel free to call us back. If you're not sure if you can eat something, please call us back. I just rather to have all the patients to have these communications, because down here in Tijuana, you will find them very warm. So we are very grateful to the patients to give them our confidence, to get them oral health, that we try always to help you the most we can with the information, with the process, and treat them more like a person, like who we are, what are your needs, how can I help you? because not all the patients need the same thing. We live on a border. Tijuana is a city that has grown a lot thanks to the medical tourism. So here everyone speaks English. Everything will be translated on a way that you can understand it for your explanation, to answer your doubts, and to give you all the information required. First of all, the customer service. Be able for the patient to contact us and get the information they're needing before they come to the clinic, during their stay, and after they go home as well. So there are 3 different stages. I get a lead, I call the patient, and we start to do questions about their medical conditions. It's very important to have that address because they can come down, and if they're not healthy, we cannot proceed with anything. So make sure all their medical conditions are in control. Any medications, blood thinners, can interfere with surgeries or some other medication that may get the gums too swollen. So there are different considerations we might have to do and address before a patient comes down. Have them prepare. Do you know what are you needing? Do you know what procedures are you gonna get done? Do you know how these procedures are performed? If these procedures require a specialist or is something that a general dentist can do. Questions like that is very important for me to inform the patient before they come down. My job as well is to coordinate to have all the specialists ready as a patient comes. So sometimes the patient comes, we have them on the chair, we start with a general dentist, seeing the overall, and then we have the periodontist, and after the periodontist comes the endodontist, then the general dentist, then comes again the periodontist to do some other things. So there are logistics. We're specialized on dental tourism. So it's my job to have everything coordinated, to have the patient in the shorter term of time, obviously not risking inequality. Also do some video calls.
Depending on what season we're having our patients. If it's our busy season, it's from all over the world. When pretty much it's summer down here, we get people from California, from Vegas, from Arizona, people that are more closely to the border here from Yuma. That's pretty much what we have. But other than that, we have patients from Washington, New York, Seattle, all those little places.
If you are looking about to the internet, you can find it 5 stars in Google. You can find it to a lot of reviews and different platforms.
A lot of patients ask, do you use different brands? We use 3M, that is worldwide. With the crowns, we use as well 3M, we use Cerec, we use Zirconia, that is Japanese, Noritake, which is one of the best brands. We use Care, that it's another very good brand of materials that they use on the States. So I like to use good materials for good procedures for good success rate. I don't like to do anything with affordable materials or affordable labs. I have certain warranty that we manage here in the clinic, and if the patient is coming down to do a procedure, I'm gonna deliver you the best material in lab, the best cement, the best of everything. So the success rate on my treatment is the highest as possible and deliver them the quality they're paying for. Because if they're paying something, they need to get what they're paying for. All our procedures have warranty, lifetime warranty. If you get, for example, a zirconia crown, we will cover full without any cost on the first 5 years. After 5 years, there's like a small percentage that you might pay for the lab expenses or the material, but all of our procedures are warranted. From root canals, from implants to crowns, composite fillings, we always provide warranty. Why? Because I know that I'm using good quality materials, good labs, and I have team that it might look young, but they have a lot of experience. It's doctors that they do 5 implants a day, not 5 implants a month.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.